body blow to the reputation of India's pharma industry.
India is called the pharmacy of the world.
The Indian government has launched a probe into 4 cough syrups manufactured by Haryana-based Maiden Pharma.
But the news that 66 children in the West African nation of Gambia may have died after consuming Indian cough syrups has created ripples around the world.
WHO is conducting further investigation with the company and regulatory authorities in India.
As someone who has been tracking the Indian pharma sector for 15 years now, as a consumer of medicines myself, and as a mother, I'm disappointed as well as worried. We have had 5 incidences of deaths in India due to poisoning caused by the same solvent, diethylene glycol, DEG. And now the country's pharma sector has managed to export the problem. And if you thought it was a maiden offense for the relatively unknown Maiden Pharma, it isn't. The company in question was already blacklisted by drug regulators in Vietnam and several of our own states. In fact, what clearly captures the attitude of the Indian drug regulators is this response of a health official who said that Maiden Pharma didn't sell these products in India, as if the lives lost in Africa did not matter to them at all. So why are such incidences happening time and again, where made in India medicines are taking lives instead of saving them? What's wrong? Where does the buck stop? And what can be done?
There is a very clear case of, as people say, desktop audits based on paper submissions. There is no physical verification of what is actually happening, what solvents are used.
No action is taken, or very paltry action like suspension for a day. When it comes to the big players, pharma manufacturers, the regulatory authorities become too lenient.
That is the reason why we're asking for a drug recall law with teeth, not the kind of nonsense that the ministry does or the CDSU does at this point in time.
These and many more aspects are getting revealed in today's episode of the Morning Brief. It is Tuesday, 11th of October, and from the Economic Times, I am your host, Kiran Somanshi, exploring the poisonous prescriptions, the dark side of Indian pharma. The responsibility for the Indian pharma is massive and global. The rot inside the overall drug regulatory system is obviously quite deep. I had to speak to someone who has been part of the system to know how deep it really is. And who better than the candid and firebrand former bureaucrat, Mr. Mahesh Zagade. Mr. Jagre, welcome to the Morning Brief. You have been the Maharashtra State FDA Commissioner between 2011 and 2014. And during that period, you really took on the pharma companies as well as set down certain ground rules for the functioning of the FDA. It would be really interesting to know from you what is wrong with the pharma regulatory system for cases like Maiden Pharma to happen every other year.
See, Kiran, thank you for having me. Let me tell you something about the Act, this Drugs and Cosmetic Act 1940, and the rules made under this Act in 1945 are extremely robust. They take care of everything that is needed to be taken care for the safety of the patients, and these are the internationally compliant kind of regulations. However, when it comes to the issue of implementation, probably it is very weak. And it's not just in India, but many countries, this is not taken very seriously. And from that perspective, and especially when you are talking about the 66 children dying in Gambia because of ethylene glycol. So this is not kind of a very rare incident. This has been happening on and off. But unfortunately, we take notice of such events only when there are deaths. But if you recollect that in 1986, in JJ Hospital, 14 patients had died because of a very rare kind of event. And then it was found out that the chemical glycerol that was administered contained ethylene glycol. So Lentin Commission was established to investigate all that, and it found the rot that it's not at just the hospital level, but at the manufacturing level, and especially the regulatory authorities, all were large-scale failures. And he had recommended very stringent kind of changes in Maharashtra at that time. The then health minister had to resign. So this is not new. I would bring to your notice that the agenda of the country is not to implement laws, only generate the laws. Coming to the very focus point of this particular ethylene glycol, whether there is any statutory framework that can prevent such incidents. Of course, such provisions do exist, but the larger issue is about why such manufacturing units are given a very lenient kind of treatment. No action is taken, or very paltry action like suspension for a day or two, or issuing the warning. That is how it is done. I believe that FR should be filed, which I used to do against the manufacturing units. In fact, one manufacturing unit in Madhya Pradesh had supplied one drug to Maharashtra Health Department containing zero active ingredient, and that particular unit is now closed. So you have to be so stringent. Now, to see this, whether the manufacturing units are doing or not, the drug controller, state drug controller, under the directions of the Drug Control General of India and the state authorities, they have to inspect these manufacturing units at least once in a year through the drug inspectors. When I was in TA as commissioner, what I found was that the inspections made by the inspectors are very perfunctory. The inspection reports are just like somebody went there, had a cup of tea, generated some kind of a very perfunctory report, and that's it, just for the sake of inspection. And I think this kind of ecosystem or this kind of administrative culture is really harming the country, the patients, their lives, and especially the export potential of this pharma industry. It's not just the killing of innocent children in Africa. And I see that the Secretary Health, Government of India, the secretaries of the FDAs or the health secretaries at the state level, drug controllers, right of the drug inspectors, all are responsible for such a tragic scene that is existing in India.
Right. We have so many different bodies. We have DCGI, we have CDSU, we have state FDA commissioners, we have also health ministry. Despite all that, still the mechanism fails. So where is the problem lying?
The problem is about the head of all these institutions, right from the Secretary Health. Under the Drugs and Cosmetics Act, there is one section 33P, and that says that to implement this law stringently across the country, the central government has a right to give directions to the state governments. But to my knowledge, till today, not a single such direction has been issued officially that such and such state is failing in implementation of law, and therefore you must really pull up your socks and start implementing. So the failure starts from there. DCGI is like a very weak body. Whatever comes to their table, and they just are responsible for that or irresponsible for that, and it ends there. They do not consider like US FDA country as a whole, and they do not check whether the provisions of the laws are getting implemented across the country or not. Now, if you come to the state FDAs or some of the states, they have state drug controllers. They are busy only in giving licenses, renewing the licenses, and then some kind of check sometimes. But otherwise, their visibility is nowhere because their secretaries and their ministers, they do not hold them accountable for whatever is the wrong. Let me give information that many secretaries or the ministers do not know what are the provisions and what is supposed to be done about this particular act. This is like ignorance at all the levels.
I was speaking to a lawyer this morning, and he told me that till now, in so many years, there has never been one drug manufacturer who has been jailed for any impurities or for any lapses that have been found in the manufacturing. What do you think? Is that true?
See, other cases keep on dragging. The FIRs are there for jailing and all that. It is there. But what he says is right. It's because of the authorities do not pursue these cases as diligently as they should have been. Now, in hip joint case, we had filed this FIR in 2013. Till today, I do not know what's happening there because my successors probably have slept over it. So this is like, it goes on and on for years. And again, it comes, I agree with the advocate you are referring to, that yes, when it comes to the big players, pharma manufacturers, the regulatory authorities become too lenient.
Where does the solution lie? Who and what can change things?
See, let me tell you, when I started taking action as a commissioner of FDA, of course, there were some problems, but politicians really do not pressurize you not to implement it. It is only the official machinery that has got immense interest in non-implementation for various reasons. I believe that if the official machinery, starting from the chief secretary in the state and the secretary health in the country, if these two authorities, they decide to do something, I think things can fall in place within a week, which I did as FDA Maharashtra Commissioner. Very next week, I started cracking all these issues. That's not difficult. But then I would not blame the politicians because they have become a punching bag every now and then. When the law is passed, it is the responsibility of the bureaucracy to implement it in letter and spirit. But that is the implementation failure attributed to the heads of the official machinery.
Right. And how do you view pharma companies in this?
Pharma companies are there to make business. They have to do the business honestly. Many times to have a purity, the plants with high-grade medicines, it requires additional investment. But the law says that even if they are dishonest, the regulatory authorities have to catch them. But this doesn't happen. But by and large, most of them are compliant on their own, not because of the regulatory authorities, because they have to have their own brand visibility in the market, brand as effective, brand that doesn't harm. But then it's not everybody. So I believe that the manufacturing organizations like MA or OPPR, they must come together and they should weed out such manufacturing units which are not compliant.
So you see that your recommendations, whatever work that you did, have they been followed up in any way?
No, not at all. In fact, there is a lot of distance to implement it because it would take away their benefits. Now, when I say benefit, the word is not right, but you can understand what I'm saying. So it's like a hafta then. Let me be very point blank on this. So the money collection. So if that is implemented, then probably their benefits will go away.
Right.
The pharma business in the world is about $1.42 trillion. And according to the WHO facts rate, 50% of it is either not properly manufactured or is not properly prescribed, under-prescribed, over-prescribed. Patients do not take it properly. So about, say, $700 billion worth of pharma products are unnecessarily sold, and that's like a chemical assault on humanity.
So as a patient, before having a simple medicine like a cough syrup, I need to watch out whether I really need to have it, and also check whether it is safe enough to be had. Quite a task, right?